to the First Nations Health Managers Association's weekly town hall with your host, Marion Crow, your resource for COVID-19 related news and information. Send us your questions to fnhma@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
TANCHE from the Nation Talk studio in Toronto. Toronto is home to many diverse nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and many other diverse nations. It is an honor, a privilege to be here with everybody who is welcoming us into your territories, your organizations, and for getting your safe, reliable, and trusted information from the First Nations Health Managers Association COVID-19 Town Hall. My name is Marion Crow. I am the Chief Executive Officer of the First Nations Health Managers Association. I live in the unceded and unsurrendered territory of our Algonquin peoples. I get the privilege of working and playing there. We have one of our offices in the territory of the Mohawks in Akwesasne, but home for me is Treaty 4 territory. I'm from Pie Pot First Nation. Hey to Auntie Judy Sugar, who's a certified First Nation health manager, a former president and the health director at Pie Pot. Lots of love to all those hardworking health directors, health managers, all you frontline folks. Thank you again. We are counting down the episodes of the FNHMA Town Hall. We've got 3 more to do, 2 more after today. I do want to say thank you to Dr. Evan Adams, who's pinch hitting today. I know we advertise Kim Daly, and we love our favorite redhead, but we love Dr. Adams. You know you're up for some fun when Evan's in the house. So thank you again, Dr. Adams. On the show today, we have with us Dr. Evan Adams from Indigenous Services Canada. We have Patricia Thompson joining us as well. And we have KRISTEN and BETH from DACHO as well, who are chiming in on the FNHMA Town Hall. So I do want to say a very special thank you. Thank you, Pascal Boulanger. Pascal is in the background. You don't get to see her, but she provides all of the translation services so that you can hear this in French. Pascal, it has been an honor working with you for 46 episodes because we also did the celebration as well. So merci beaucoup, Pascal. Thank you so much. Now, let's kick it off with some stats. Dr. Evan Adams, come on into the crow's nest.
Marion, how are you? Can you hear me okay?
You sound perfect.
Wonderful. Thanks for inviting me back. I'm on the road today, so I'm in what's now the city of Vancouver in Musqueam, Tsleil-Waututh, and Squamish territory. And there's so much to talk about in COVID. I was thinking that COVID was going to slow down a bit, but there's still a lot happening out there. So just a few things to describe to you, well, maybe more than a few things. The number of active cases in First Nations across the country is still over 800. And that's a little higher than the last time that I spoke to you. And the hope was, though, that the number of active cases of COVID would actually go down. So we're not sure what's happening out there. And I should take a moment to acknowledge Saskatchewan, who's having quite a significant outbreak. Uh, uh, so those numbers are in the press, so I'm not betraying any confidence. Is that they have over 200 cases. That's a pretty significant outbreak, and there are certainly a number of players who are working on that as we speak, including the Red Cross and Canadian Armed Forces, local public health of the province of Ontario, my office for sure. And we've had 15 months to get ready for any kind of outbreak, and it's still hard. So some of our discoveries this week, we've been looking at the number of active cases amongst First Nations versus the number of active cases amongst other Canadians or the general Canadian population. And our active case rate is about 4 times higher than that of other Canadians. And this after, at the beginning, we did so well. During the first wave, we were at 0.4 times that of other Canadians, and now we're about 4 times higher. That's pretty dramatic and surprising for us. And we know that the chances of First Nations people getting COVID is still higher now than the general population. Our death rate is, however, overall only about 60% of that of other Canadians. So even though we're more likely to get COVID, we're also more likely to have mild disease. And this is perhaps because it's been mainly our young people, like over 40% of our cases are now amongst underage people, or under the age of 19. We're also seeing that there are, even though the number of deaths are small amongst First Nations, we still have a rate that's slightly higher than the Canadian average. And those deaths are occurring in the older age groups, like over 50, over 60, over 70. It's just a reminder to us that the work that we're doing is mainly for those people who do so badly when they do COVID, or when they get COVID. Those younger populations who have mild disease, personally, I'm less worried about them, and we must do our best for those knowledge keepers. I know people are talking about variants of concern, and we're watching them too, especially the Delta variant. I hear a lot of people being concerned about the Delta variant, or what's called the double mutant. So we're watching ICU admissions amongst our people. We're watching deaths amongst our people to see if it's actually going to go up, because perhaps the coverage of that particular variant from our current vaccines isn't as strong as we'd like it. So we're watching it, but there's still no signal that we're doing worse off. And we're really hopeful about the current vaccine's ability to cover for all of the variants. And some of that data is still coming in. Some of our communities are monitoring off-reserve populations, and generally we're seeing worse outcomes for people who don't live in our communities. Our urban cousins tend to do worse than those of us who live within our communities. And the inverse trend of vaccination, the more people who are vaccinated, the less or the fewer cases of COVID. That's still true. And a couple of weeks ago, we hit quite a benchmark. 72.5% of First Nations in our communities have had their first vaccination. Canada, as some of you may know, has the highest first vaccine rate in the world. Over 32 million doses have come to Canada's 38 million people. So there's a lot of, we're happy about that for sure. And we're also talking about, beginning to talk about life after vaccination. And I think probably the viewers and listeners are curious about that too. When do we get together, more of us together would it be possible for us to take our masks off in certain instances with other people who are doubly vaccinated, like is happening in some places in the United States? Will we be able to go to larger gatherings without being fearful of a large outbreak from that? The 12 to 17-year-olds are getting vaccinated, and we want to keep that vaccination rate really high. So what are young people thinking? What are the barriers for them to for vaccine acceptance? And of course, I think so many of us are thinking about the 215. And I know for me, both my parents went to residential school. It was just a reminder about what they went through, and to say that they deserved better than they got. So hopefully we as a society are going to do better. And personally, I'm thinking about how my work needs to prevent premature deaths in our people all across the board, because our people sometimes suffer from worse outcomes than other parts of the population. So we need to keep an eye out on all of those things, not just in the area of COVID. So that's the view from here, and I'm happy to take any questions or comments. There's a lot to talk about still.
Thank you, Dr. Adams. It is always a privilege to have your unique perspective. You still live in your nation. You're a physician, a movie star, an actor, and it is a privilege to share the crow's nest with you. Thank you for all the work that you are doing. I can't even imagine how exhausted you are, but it is true passion.
It is very tiring work for sure. So thank you for acknowledging that. It's been an emergency for 15 months. So those of us who work in this area, we're called to duty, and it does take a toll. I think on those workers. They're spending less time with their families, less time on their own health, trying to do the best they can to protect others. But it really, and I'm seeing and hearing this from many more workers, they really do care. They really are kind. They really want to help. They're not just doing it because it's their job. So yeah, I want to thank them too.
Oh, that's such a good segue, Dr. Adams. You know what? If you have a question for one of these panelists, or for the next couple of shows, if you have a comment for upcoming guests, or if you simply just want to say thank you to your health director, your community health nurse, that nurse in charge, your health portfolio counselor, all of the custodians keeping everything so that it is, COVID free. Anyone, I want to hear from you. Let me get it onto the air, whether that's the radio station that you are listening to right now or the TV show, because we are on APTN on Saturdays. It's 5 o'clock Eastern, but please check your local listings for the time that you can watch this broadcast on Saturday on APTN. But send those questions, send those thank yous. We want to hear from you. You can send them to fnhma@ihtoday.ca. Thank you. Now, let's go over to our next guest. And actually, before I do, speaking of a shout out, there's already one in the inbox. The power and magic of our Moccasin Telegraph is on fire. Carol, thanks for watching, and hello to you. I really appreciate you getting your safe, reliable, and trusted COVID information here at the FNHMA Town Hall. I am going to welcome in now Patricia Thompson. Patricia, Certified First Nation Health Manager, the board member representing Saskatchewan. Good old Prairie Pride there showing. And I just want to say, Patsy is my boss, one of them, because she's on my board, and She's my cousin. Come on into the crow's nest, cuz. Welcome, Patsy.
Well, hello. It's great to be here, and I appreciate the opportunity to meet such knowledgeable people. And I'm looking forward to it. And yeah, so it's great. I thank you for having me.
Patsy, are you going to share with us some of your experience in being diagnosed with a positive COVID-19 a couple of months ago? Tell us about that journey, Patsy.
Okay.
And I'm just going to do a double check. Are we seeing Patsy? All right, Patsy. Awesome. Come on in and share that story. Inspire us.
Well, I don't know how inspiring it was, but it definitely was a learning experience. I'll tell you, I tested positive on December 26th, right after Christmas. Of course, after I sat down with my son and his family because they were in my bubble, and yeah, so I was feeling a little bit, kind of a little bit off. I had a bit of a cold, the sniffles, head cold, basically. So what I did was I went and drove to the city, which is about an hour away, went through the drive-through, came home, locked myself away in my home, and I waited. I think it took about 3 days for the test results to come in. And they phoned me on a Saturday and they said I had tested positive. So then they were asking me questions about who I'd been with and my contacts in them. And so I did that. And I said before, one of the things I did is I wanted to tell my kids first because, with all the media attention that was given to COVID, it's a scary situation, especially since I have underlying issues, right? Especially with my lungs. And we had talked about it before, and my nephew is really protective of me as well as my children. But he said, Auntie, you can't get COVID. He said, because you have your lung problems, whatever. And, I was just trying to build my life and be as normal as possible in a very unusual environment. Anyway, so once I tested positive, I contacted my kids and anybody close I was around, and I let them know that I was positive. I was going to be home, and that was it. So I live alone, so I rarely cook because it's just for me, right? So it's like as soon as people found out, and I have a sister that lives in Labrador. So she was all besides herself because she couldn't be there for me. No one could be there for me. So there was a lot of coordinating behind the scenes. And as a result, and I have a really good support system. Thank God I do. It made me think a lot about those people that don't have good support systems. So anyway, for the first 3 days of COVID, I was head cold, sniffles, stuffed nose, whatever. I had people providing me, relatives giving me traditional medicines. So the first 3 days were a head cold, and then I started feeling better. And then I started feeling good. And then day 10, 11, and 12, 24/7 fever. No energy, could not do anything. I was alone. I was by myself. And when you're sick, you need people around you, right? You need supports, and it'd be nice if someone could give me a drink of juice or something, right? Anyway, so my biggest challenge was the mental health issue. I got over the fever and all of the symptoms surrounding it. I had people texting me and checking on me, and my oldest son, was the biggest support for us, because after I tested positive, my younger son and his family, and my daughter and her family all tested positive as well. So my son ended up being kind of the runners for everybody. So he was taking food to people. He was making meals for me. He would say, "Mom, your meal's ready," and put on his mask, open the door. It was like, when you see in the prisons where they open the little panel door and shove your food in. That was kind of what it was like for me. But it was I didn't get the symptoms as bad as I thought. I had to actually call my nephew and say, because my nephew couldn't eat for like 3 days. He was so full of anxiety. I'm sure he thought I had one foot in the grave. But I started, when COVID started, it was either eat and stay home or do something else with my time. I chose to exercise. So because of my exercise, I started running, I started eating properly. And I think because I changed my lifestyle, that really impacted how I was able to deal with COVID and how I was able to overcome it. And, the signs and symptoms of COVID weren't that bad. It was the mental health issues that really challenged me. I watched every series on YouTube that you can think of. I couldn't taste the food that people brought to me. I was, couldn't smell anything. Used traditional medicines. For me, I had the chaga tea. I took the skunk oil and whatever, and managed to do that. So it was that traditional foundation that helped me through everything I needed to do, and included my spirituality, smudging and praying and just being a part of that, having that inside of me that really helped being able to manage that. So for those that don't, I feel for those people, because as the Senior Indigenous Advisor to the Ministry of Social Services, I have been providing support in the COVID hotels. So I am seeing the people that don't have support systems, that are homeless, couch surfing, that in our process, and it's heartbreaking to see that those people struggling to get through, not only dealing with the illness, but not having that support system that we need in there. I just want to say, as Indigenous people, we have to be more respectful to each other, more responsible, and know what we can do, because it's time. I think we're in a very critical time, and being with it's time to move on those 94 calls to action, and those 94 calls to action start with us. If we can learn to treat each other better, support each other, respect each other, then you know what, everybody else is going to do the same thing. So with that, I want to say thank you, and I hope that something has resonated with the people out there, and all the best, and I pray for all my relations. Thank you.
Oh, cousin, you got me feeling pretty emotional. What a journey you have been on. And thank you for also reminding folks that, we have those 7 core values to think about our next 7 generations. So thank you for that reminder, and all of the traditional medications that we use to help our wellness. You unpacked so much there, Patsy, and it is appreciated. I'll get you to mute yourself, but don't go away, because we will likely have questions. Those questions can go to FNHMA at ihtoday.ca. Pam, I see that you are also watching, so thank you, Pam. Again, getting your trusted, reliable, and credible information here on the FNHMA Town Hall. Now it is a pleasure to welcome 2 ladies from TANCHE. We are so excited to hear both of you speak speak about what's happening. We very rarely get to have kinship from the north, and coming from the south, I really value your perspective. So, KRISTEN, come on in to the crow's nest. Welcome.
Merci, Marian. So I'll start off introducing myself in my language. KRISTEN TANCHE SUJE, Pudukwe Gotseate, Semo, Kathy TANCHE Uje, Seta, Gunnar Paulson Uje. So my name is KRISTEN TANCHE. I'm from Pudukwe, Fort Simpson in the Northwest Territories. My mother is Kathy TANCHE and my father is Gunnar Paulson. I'm a member of the Pudukwe First Nation, which is part of TANCHE First Nations. Our region is located in southern Northwest Territories and is comprised of multiple communities and organizations. So I currently work for my regional Indigenous governance organization, TANCHE First Nations, as their regional health and wellness coordinator. My coworker Beth will introduce herself shortly also. But just to note, we are sitting beside each other right now because currently we have no cases of COVID in our region or in our community, and we are in the same COVID bubble. So we see each other on a day-to-day basis, work together, and we are both fully vaccinated. In fact, our community has many vaccinations. I think the percentage of the amount of people vaccinated in our community is well over 60, I'm gonna say. So TANCHE First Nations was originally established for negotiations of self-governance, and currently we are still in negotiations. Collectively, there are 9 member organizations that make up TANCHE First Nations. And since its inception, the organization has really grown to include lands and resources, education, language, and health and wellness. So the TANCHE Health and Wellness Division is fairly new. It was established just over a year ago with the intent of forming a vision of health and wellness from the Indigenous communities and for TANCHE First Nations. However, the position was established and then COVID hit a month after. So it's been a challenge as our entire territory adhered to COVID restrictions and we all moved home. But out of those challenges came an opportunity to deliver a TANCHE healing program, and that's what we're really here to talk to everyone about and share. So more than a year ago, we started to think about delivering a healing pilot program in our region. Then our leaders started talking about the increased mental health and addictions issues related to COVID. In reality, our leaders have been talking about some of these social issues for some time, but last summer they really formalized that in a form of a motion during a leadership meeting calling for the delivery of a healing program. So now our reality in the Northwest Territories in terms of access to mental health and addiction services is different from Southern Canada. Our system is currently set up in a way that the government of the Northwest Territories, so our territorial government, delivers the bulk of our mental health and wellness services. They have programs like the community counseling program. Then if people want to access longer term programming like a residential treatment program to deal with addictions issues and or trauma, people have to go to Southern Canada. And they typically do this through the government of the Northwest Territories. There's other programs that the government offers that organizations apply to related to health and wellness. So the On the Land Healing Program is one which partially funded the 30-day healing program that we delivered with Shakes the Dust Hope Consulting. But then there's also other health and wellness programs that the government offers, and communities do access to deliver their own community-led programs. But these programs are often sporadic and not always consistent. So at any given time, what that means is that if I, as a Decho Dene woman, was seeking assistance in healing that was culturally relevant, or if I wanted to see an Indigenous counselor, I probably couldn't do that. So furthermore, there's lots of people that do benefit from attending these Southern residential treatment facilities, but there's a large percentage of people that say that they would prefer to heal in their own cultural systems, on their own lands, in their own territory. So people in the Northwest Territories and in the Decho have been calling for more on-the-land healing programs for some time, and for our own residential treatment facility and more healing centers. This has been really a hot topic politically, but also among the people. So throw COVID into this. You have less people attending Southern residential treatment facilities because people don't want to travel, they can't travel, things are shutting down everywhere. But also too, when we leave the Northwest Territories, currently you have to isolate for a period of time before joining the general population again. And so there's an additional barrier. Our territory shut down pretty much as soon as COVID hit to people coming in and out. And like I said, you have to isolate before you join the general population. So there's COVID, and then you already have social issues, which our leaders were saying, we're talking about being increased because of COVID. So at the Dehcho First Nations level, we were brainstorming on how to deliver safe regional and territory healing programs during a pandemic. In the fall of 2020, funds intended to assist in increased mental health issues due to COVID became available to our region, and I believe to the rest of the territory from the federal government through Indigenous Services Canada. And because of this, we were able to start the motions of planning and really making things happen. I like to look at things in a positive light. And while the pandemic has been really difficult for our people, for our nation, for everyone, there came an opportunity for us to try to work on some solutions to some of the issues that our leaders were talking about. So the dreaming, the words of the people, and the planning that could really put things into action. Things were able to be put into action with an increase in capacity and an increase in funds. So over the years, much has been talked about in our region in terms of health and wellness and land, language, culture, and how they all intersect. I think I could probably talk for another 20 minutes about some of the work done and some of the inspiring things I've seen and felt at land-based programs, and some of the stories of people changing their lives around because of those experiences. But I usually like to sum it all up with something that an elder from this area, Jonas Antoine, told me once. We were talking about health and wellness and the land and just having this conversation, and he told me it's simple. We need to go back to the land. So this is a sentiment that many in our region hold, the concept that we need to go back to the land to heal. We need to return to our culture to heal. We need to immerse ourselves in those ways to heal. So with all that train of thinking, we started seeking out partners to deliver a 30-day healing program. Thankfully, we were able to partner with an Indigenous couple that lived in the Northwest Territories. Shakes the Dust Hope Consulting owners, Frank Hope and Bev Bagnall, agreed to work with our nation, with their nation, to deliver their Journey to My Best Self healing program. Not only had they delivered a healing program during the pandemic already, Frank is Dehcho Dene. He is fluent in our language. He grew up here. He grew up in the north. His partner, Bev, Swampy Cree, but now part of Dehcho First Nations, also came with cultural knowledge and had lived in our region for many years. They both came with experience in Western methods of healing, but also strong cultural and spiritual teachings to share. So I like to say that they really came with the magic, the ability to work and connect with people and provide culturally relevant services in our region. It was important from the start to look at the program, look at a program that included Dehcho people as participants, as staff, to have Indigenous people working with us, to be on the land, and of course to deliver a program that was safe and that adhered to COVID protocols. So while being fairly new in the health and wellness world, Dehcho First Nations has been delivering on-the-land programs for more than 10 years formally, but informally for a lot longer, because like all Indigenous people, our culture is historically land-based. So I guess you could say we have all been doing it since time immemorial. We knew from our people that if we were going to be doing a healing program, it had to be partly or fully on the land. So what a lead up. You guys don't even know when it was. So the Journey to My Best Self healing program happened in March and April of 2021. So just a few months ago, our very first one. It happened at a Kali Lake and Jimiri Rivers traditional area, and then in the Katlo Dehche Dene Wellness Center and the Katlo Dehche First Nations area. The program had 15 Dehcho participants start and 15 finish, with no encounters, no cases of COVID related to our group for 30 days. So my heart swells with pride for everyone who took the program and all the staff and the partners who made it all possible. I think as we started out in this, things really fell into place with a lot of hard work, But I think it was so successful because of the community engagement, the participants' willingness to be engaged, because we had Shakes the Dust Hope Consulting as partners, and because of people working tirelessly. So with that, I really saved a lot of the program details and how we did it during a pandemic to my coworker, Beth Hudson. Masicho, everyone.
Hi, everyone. Thank you for having me here today. So my name is Beth Hudson, and I'm originally from Sucker Creek First Nation in Treaty 8 territory. I was actually adopted by a non-Indigenous family right out of the hospital, and so my personal journey has a lot to do with reconnecting to my own roots. So my birth mother was Terry Lynn Willier, my grandmother was Sylvia Willier, and my grandfather is Terry Sinclair. My parents who raised me in Amiskwaci, Waskagan, also known as Edmonton, were Kathy and Barry Warner Hudson. I'm currently a guest living in Hidlikwe First Nation, and I'm just so grateful for the Dehcho region for accepting me as I continue to regrow my roots and find connection. It's been a really powerful story for me, and so my position as the regional on the land coordinator is really a dream come true. I'm all about reconnection and supporting other youth, so I'm just so happy to have this opportunity. And there's so many things I could say as well, but I'll start to talk about more about this running programming in a pandemic, which is a really interesting journey, that's for sure. So what I'm hoping to share with you all today are just some of the lessons learned from planning, organizing, and running a 30-day healing program during a global pandemic. My role in the 30-day healing program was to handle just logistics, essentially, and being on the ground, making sure it became a reality. KRISTEN talked a lot about what led up to the program and why it's so needed within our region. And so the foundations were already in place. Part of this whole thing, which was wild, was I didn't actually start with Dehcho First Nations until January of this year. And so I walked into the position really excited and knowing that I had 2 months essentially to make this happen. And it's asking a lot. We wanted to do it well. And, you know, I came in kind of knowing about some of the work KRISTEN's done before and whatnot. And it was really exciting. And I was like, let's do this and see what happens. So COVID-19 is a reality we've all had to face. Many programs and events were canceled in 2020 and continue to remain off the table, no matter how big or small the impacts of these programs were. But what has resulted is that noticeable gap in services and supports available for community members to access. And we've already talked quite a bit about that and the impact it's had on mental health. And so the 30-day program was specifically designed to help participants who were struggling with mental health and addiction. And we knew that hosting an in-person land-based program was going to be the top priority. How are we going to make this happen was the biggest question. And you know, our biggest priority was that we needed to keep everyone safe. It's more than just the participants and staff on the ground. It's also, you know, the communities that are involved, the region involved, and then a larger territory too. We couldn't take those risks. And so we really had to put a lot of thought and planning into it. Ultimately, my biggest lesson learned has been that collaboration is key, especially when tackling barriers that affect a community or region. Community can really be defined as anything from your own like intrapersonal space and relationship with yourself to the physical community that you live in and around you. And there's so many different communities that we interact with every day. Understandably, COVID-19 has been a barrier impacting all of us. It's a global thing. We're all currently, you know, dealing with COVID, and it's a reality we're all facing. And so the first thing that we really did was we called one of our territorial partners, the Dechinta Center for Research and Learning, really incredible resource for our community. And we were able to reach out to them and say, we know you've been running land-based programming. They're very much based in education, access, and land-based programming. And we reached out to them and said, are you willing to share your COVID-19 protocols with us? Can we talk about it? Can we get these wheels spinning? We know we didn't have to start from scratch on this. There have been other previously successfully run programs during the pandemic, and we wanted to build on that. We didn't want to start at ground zero and try something completely new. We wanted to go with what's working already and then build on that, because we knew this was, you know, a pretty complex and long-term program. So we really needed to make sure, again, we had a really strong foundation. So after reviewing the document that the TANCHE sent us, I was also able to further review the emerging Wisely guidelines, which in the NWT are the guidelines provided by the Chief Public Health Officer for the NWT. And I was able to put together a COVID-19 procedural document for participants, staff, and contractors of the program. There's no magical formula in this document. Included are the guidelines for social distancing, wearing correct PPE, and then cleaning and sanitization procedures. What's different is that this is a land-based program and we're building it from scratch. So on top of trying to run this program in a pandemic, trying to actually set up essentially like a wall tent camp in the middle of nowhere for 25 people essentially that we anticipated would be coming and going. So it was a big ask, but we were able to at least find a location and make it happen. I do want to share that the 30-day healing program was really broken up into kind of two sections. One was a 10-day on the land portion, which we thought was so important, and I'll primarily talk about that. But there was also that 20-day portion at the Dene Wellness Center as well, which was really cool just to have that blended approach to be able to provide an experience on the land and then to be able to go to a location that isn't as challenging. Based on our time constraints, we did this in -30 for a week. So we had participants truly learning to survive on the land. That was a part of it. That was a huge part of it, of what the program was. It really is survival, working together. It was not fun being up every hour to put wood into that wood stove, but you had to, and everyone looked after each other. And again, that's what these land-based programs do. They put the responsibility on individuals to have to survive and look out for each other. And you're going to grow from that, I think, regardless. So that's the reality there. And the way we were able to keep it safe the entire time is really acknowledging that because we were able to set this on the land camp up in a location that wasn't super accessible and easily manageable, we were able to create that bubble of safety for our participants and staff, which was also an important concept within our COVID-19 protocols and procedures. So we provided a ton of PPE, including lots of different options. We also recognize that, having participants mask up the entire time wouldn't be great for the type of healing program you're running. So also included options like face shields and things like that. So if people needed to remain visible, they could, or if they needed to enhance their connection with each other, they could. What we did with our COVID guidelines was essentially work backwards and thinking, if I'm going to have 15 participants on the land, what do I need to ensure I'm providing for them before we even get there? There are challenges along the way, but we were able to say, well, we can safely put 2 people per wall tent if we have big enough wall tents. And we had some smaller wall tents, so knowing that they would only be for couples if couples showed up, and we did have some couples arrive, which was really cool to have that, or single occupation if we needed to do that. So really thinking about the infrastructure needs, how do we keep people spaced safely, how do we ensure they're going to be able to access their food and water, all these sorts of things that, again, these services didn't exist in the camp where we set up. So we had water tanks and water deliveries and porta potties and actually building certain infrastructure. So it was pretty wild, and I talked about collaboration is key, and we really were able to rely on Jean Marie River First Nation, which was the community whose land we were able to host the On the Land program on, and they were such incredible support for the entire thing. I cannot, thank the communities enough, the region enough, and our partners. All of the barriers that came up, we were able to find solutions for fairly quickly because of the support and belief we had from those around us. And if Jean Marie River, wasn't there to bring us water, to help us with, things that came up on the ground, this program wouldn't have been successful. And I could say that for so many people involved. So it's such a big thing to mention. Again, it's just that collaboration piece. We all need to work together truly, even if it's not all health and wellness, right? Working with education, working with all of the other supports that are available. It's so important. And then beyond that as well, I just want to quickly touch on the bubble of safety in terms of within our camp, we had clear signage. We didn't allow visitors to come in and out. If visitors were going to come in, they were pre-screened. They had to fill out a bunch of paperwork. We brought them in. I was on the ground the whole time helping to monitor, keep everyone safe. A lot of paperwork was involved in all of this, but we were ultimately really able to focus on keeping this a community bubble for the camp. And so they were able to participate in this program in an almost normal sense. Still a very in-depth program. There's a lot they're going through, a very, very challenging program, but ultimately, as KRISTEN already said, we had 15 participants who were able to attend, and all 15 completed the entire program, which is something we didn't quite expect. We know how strong people are up here and everything like that, but as many programmers know, to have 15 start and 15 end, and for it to be 30 days is just incredible. And so all I can really say is I'm so proud of everyone to hear the stories coming out, to hear their words coming out. If you Google the program, I think some news stories might come up. People can read more about it if they're interested, get some more details, but super cool to see just the positive comments and the support we've gotten. It really helps us stay motivated and inspired to keep this work going. Our contractors, Shakes the Dust Health Consulting, are truly incredible Northern-based counselors who have made such positive impacts on those seeking treatment or support. Again, if we don't have to send people down to the south where they have to uproot from their families, uproot from their language, from their community, from all their supports, if we're able to provide those opportunities for people to heal on their land, again, it's just so significant and so impactful. And to be able to do this during a pandemic is a pretty special experience, and we know that. And so, again, to just be able to be here and talk more about it is really meaningful to us. I know from a personal standpoint, we all really got to experience the benefits of camp life. My own mental health, as stressful as it was certainly increased. From living in a wall tent with the wood stove, sleeping on spruce boughs, literally keeping ourselves alive, exploring the land and world around us, hunting, making crafts, ice fishing, and many other cultural activities that helped to ground us all was just incredible. We held ceremony, we gifted the land, and used special teachings to create space around us. And then we also had incredible staffing from start to finish, both from our cooks, our maintenance staff, and the amazing elders and knowledge holders that were also able to come and gift participants not only with knowledge and stories, but also with language and a few other supports and resources for them in their journey. So overall, it was an incredible program. I can't say enough about how awesome it felt to not only ground myself, but to be involved in something like this. And then to be able to work with KRISTEN on something so, massive right away is so cool. And it's really exciting, and I can't wait to do more. I'm just super proud to be a part of it all. And so, yeah, hopefully the next time we do this, we won't have to do it with the global pandemic at the same time. It definitely added some layers of challenge, but for anyone who's thinking about it, we're here to tell you it's possible, you can do it, and collaboration is key. So reach out if you need advice or have questions. So thank you so much.
I'm in awe. I just want to say congratulations. This is no small victory in normal times, let alone during a global pandemic, and to have that kind of output. Like, when do you hear that kind of stuttering from Marion Crow? I'm in awe, and congratulations to both of you. Wow. Resilience in action, I'll tell you that. Wow. So I'm going to transition now from that and take a look at a couple of the questions in the inbox. So, Dr. Adams, come on back in. Dr. Adams, just want to acknowledge some of the words that you mentioned around Saskatchewan, and obviously Chief Friday. We've been following your story. We've read your press releases, and know that you have love and support from the First Nation Health Managers Association. On that note, Dr. Adams, when you hear of 18 people in a home, are you surprised that we're seeing this kind of numbers? And explain for our non-Indigenous Canada who's listening and watching why this isn't out of the norm for some of our nations.
Yes, this is called the social determinants of health. These are parts of how we live and where we live, and that is connected to our, our physical bodies and our minds and spirit. And Saskatchewan is known for having some challenges in that regard. There's overcrowding. I'm not being pejorative in any way. That the chief describes his community in such a way. There's overcrowding. There's a need for clean water, and when it comes to COVID, you need to be able to wash your hands and clean your surfaces. You need to be able to have isolation spaces, places where you can go, where either the person who's infected or the rest who are not affected yet can go and isolate. So there's a lot that can be done to try and help people not get COVID, and not blame people who get COVID. Sometimes we say, "Oh, you were having gatherings, or you were at a gathering, and that's why you got COVID." But it's often related to the conditions that we live in as well.
Dr. Adams, just a great reminder for all of the viewers and listeners. If you have not already done so, in action to the TRC calls to action, take a look at the Indigenous social determinants of health and unpack some of the situations that are the reality in many nations across Turtle Island. Cousin, do you want to unmute yourself there, Patsy, and come on back in? You had talked about, being alone during your diagnosis, and Dr. Adams just touched a bit upon some of the stigma around COVID-19. Did you feel stigma in your diagnosis, Patsy, or was everyone receptive? What did that look like for you, Patsy?
Okay. Well, for me, it was, I think there was a lot of people, there was people saying, well, where did blame as to where did it come from? I was like, who knows and who cares, right? Let's deal with the situation we have now. It doesn't matter. It's all over. There is no pinpointing of where it comes from. We just have to be able to provide the support and meet the needs of the individual. I think that for me was the biggest thing, is that we can't blame because there is no one to blame, right? It comes, you get it, you deal with it. And it, unfortunately, for Indigenous people, I think for me especially, I can only speak for me because it was very challenging, because we're social beings. Our ceremonies, our gatherings are all connected to our families and our relations. And I think that was the biggest hurdle for me, is not having that access to my relations and ceremonies and things as well. So, yeah.
Thank you for sharing that, Patsy. Again, it's not about blaming and shaming. It is about keeping protected, upholding those public health guidelines, and loving yourself and others around you. At the end of the day, that's where we thrive and where we're resilient, is looking after our aunties, our cousins, our kinship. Now, I want to call back in KRISTEN and Beth. Where do we hear, in like a minute or less, not to put too much pressure on you, where do we find out more information? Will you invite me up? It sounds like heaven.
If you want to isolate for 2 weeks before you join the public people.
Yeah, I think we're down to 8 days now if you're fully vaccinated, so people can start planning for that.
So you can call me or Beth. If you just go onto the Deitcho First Nations website, you can look up our email address or our phone number. Like Beth said, you can also Google, and there's some really nice press that has gone out about the program. The program was project-based. And so what we're looking for now is to continue. We need the full-time position. We need this program to happen annually. And so that's what our dream is right now. We're hoping for that to happen continuously.
Hey, all you funders, did you hear that? We need to sustain this amazing program. I have never been knocked off my socks so much in the short time that you were sharing your journey. Again, just a huge congratulations to you both. I hope you feel proud. You are Indigenous boss babes. I had to do a shout out. She Native in Saskatoon. Get your Indigenous boss babe mug from them. So buy Indigenous as well. And I'm sad to say it's time to go into the wrap up. I loved all of the guests we had today and over the past 45 town hall episodes. And we couldn't do it without our partners. Indigenous media partners have stepped up in big ways. I want to say thank you. Mi'kmaq, Maliseed, Native News in Nova Scotia, The Wolf 95.7 in Fredericton, Nation News in Montreal. Of course, FNHMA, we thank you. And to Patsy, one of our board members, a special thank you today. Of course, Element FM in Toronto and Ottawa, and Nish in Beg. I always get that wrong. North Bay, I am so sorry. Wawate News in the Sioux. NCIFM, I can't wait to talk to you tomorrow. APTN, NBC News, Eagle Feather News, Alberta Native News, CJWE in Calgary, CFWE in Edmonton, CKLB in Yellowknife up there in the NWT, First Nations Drum, CFNR in Terrence, and Hashlasa newspaper in British Columbia. You can also watch this on APTN, as I already mentioned. It's the edited version that you're going to see, so a little bit more polished from my perspective on APTN Saturdays. Check your local listings. And hey, there's live rebroadcast. Well, not live rebroadcast. This is going in the blooper reel, Kim Mumford, our director of comms. We also have this rebroadcast on a couple of radio stations too, so check your local listings. And until next time, stay safe, stay healthy. Hi.